Hello. Thank you to the American Institute of Dental Public Health for the invitation to speak to all of you today. And thanks to them for once again holding this now annual event, recognizing all the nation's DPH graduates. This is my third year speaking at this event, and I'd like to join all my colleagues to congratulate each and every one of you for a monumental achievement in graduating from your dental public health residency. As a dental public health residency graduate and diplomate of the American Board of Dental Public Health myself, I highly value and respect your commitment to dental public health. Over the last 2.5 years, public health has been at the forefront of the pandemic, as you know. And if anything good has come out of the pandemic, we've seen a renewed emphasis on oral health integration with overall health. This makes sense, of course, as you cannot separate the mouth from the rest of the body. For decades, we've known about the links between oral diseases and systemic diseases like cardiovascular disease, lung disease, cognitive issues, pregnancy issues, and other inflammatory processes. With the pandemic, we have played, as oral health professionals, a very important role doing testing, vaccinations, and so forth. But there's a bigger role that we can play moving forward in screening and doing point of care testing for chronic diseases like depression, hypertension, diabetes, high cholesterol, and more. And so I challenge you to think first as healthcare professionals, and then secondly as oral health professionals. We know there are 28.2 million Americans that see a dental provider each year and not a medical provider. So there's a tremendous opportunity for us to get involved in screening for chronic diseases and educating our patients about them. Another thing is that we have to collectively break or continue to break down the silos, not just between oral health and medicine, but within oral health itself. We cannot continue to fight among ourselves about the best way to provide services to vulnerable populations like older adults or adults living in poverty, and we have to work together. Of course, breaking down silos between dentistry and medicine starts with interprofessional education and interprofessional collaborations. You can't expect our medical counterparts to just quickly jump in on oral health integration as they face some of the workforce strains that we do in dentistry. Breaking down silos and embracing the medical dental integration starts and ends with relationships at the local community level. And each of you has a role in building those collaborations throughout the healthcare system. As oral health professionals, you'll be in high demand as you look upstream to plan and manage complex oral health programs, evaluate and recommend improvements to dental delivery systems, conducting surveillance, conducting research, and so forth, and serving as an advocate for oral health and public health in the future. But we know that the field of dental public health is not an easy road. You'll face a lot of challenges along the way. First and foremost, we know that access to affordable, culturally competent, and geographically available quality oral health care is still challenged throughout our country. And your leadership is going to be critical at the local, community, state, and national level in the future to help ensure that the public health voice will continue to be heard. There are many, many ways to address the access to health care problems in this country. That's why we need each of you to objectively look at all these different alternative workforce models, such as dental therapists, expanded function dental assistants, community dental health workers, our coordinators, community health workers, independent and collaborative practice dental hygienists, as all of these may be possible solutions to access problems. With the release of that first Surgeon General's report on oral health in 2000, we made a statement that oral health means much more than healthy teeth, and that it's integral to the overall health and well-being of all Americans. That still holds true today, and in fact, you can't have overall health without first having oral health. And as we welcome all of you into the dental public health world, we know that each of you, through your respective dental public health residencies have been given the knowledge, skills, and abilities to emerge as leaders within communities, within organized dentistry, and within the profession itself. So once again, congratulations to all of you upon your graduation from a dental public health residency program in the country. I wish you much success in the future. Thanks for all the residency directors and faculty who've played a major role in shaping all of you, and good luck to you in the future. Thank you.